Okay, so moving on to the next part, I've lost count of how many parts we're at, to tell you the truth, of chapter 23. And that's all about protozoans, because there's some really gnarly protozoans out there. And a lot of them actually can, since they can form actually this thing, they can go through a process known as encystment, where they form a cyst, like this protective coating around themselves, so that when we ingest something that is contaminated with them, they have the cyst that protects themselves in a way that helps protect them from, from stomach acid. So they can be ingested by us. They go through our stomach at like no problem, and then they situate themselves in our intestine, and then that's where they wreak havoc. So not all protozoan have these, but these cysts, but a lot of times they do. So for example, Giardia has a cyst, and that's how it gets through the stomach acid. It's actually how it also protects itself from things like heat, chlorination, desiccation, all these kind of things, just because it forms a cyst. So what you'll see is that these particular protozoa live in like two different forms. One of them is their motile trophozoite form, where they are feeding and they're like roaming around and going everywhere and stuff. And then they can form a cyst. They can go through encyst, E-N-C-Y-S-T-M-E-N-T. Hold on, I'm probably sure. So they can form a cyst, right? This protective covering. And the formation of a cyst is, I'm just going to write it out here, encystment, like that. So, and that's how they can protect themselves from, like, just our stomach acid, etc. And then once they find a comfortable habitat, like our GI tract, for example, like our gut, our intestines, that's when they situate themselves and exist. So in that term, it's exist, like that. Okay, so Giardia, you've probably heard of Giardia. It's also known as like camper's diarrhea. It happens even in the US. It's quite prevalent in third world countries, but it can happen in the US as well, especially with people that are like campers or something like that, people who would normally be in an environment where they could potentially drink contaminated water. That's the main method of transmission with Giardia. So it's one of the more common waterborne GI diseases in the United States, camper's diarrhea. The signs and symptoms. So a lot of times it can be asymptomatic. It can get worse, right? It can get worse and then give us all sorts of nasty symptoms, which basically include diarrhea, in which case you have like your diarrhea smells like really bad. And like it has like a frothy, greasy kind of consistency to it. Okay, you have like flatulence, abdominal pain, nausea, vomiting, loss of appetite, ineffective absorption of nutrients, and we'll talk about why there's an ineffective absorption of nutrients as well, and even a low-grade fever. The patient's stool smells, like I said, really nasty. It's basically like the smell of rotten eggs, so not fun. And you can have it, it's quite common. I actually don't know how many millions people get it per year, but it is quite common. What's not common is when it becomes chronic, and so that can happen, and when it becomes chronic, it's really bad. And that actually happened to me, my dad. I've been kind of taking it easy, not telling you everything that my parents and family have gotten. So this is the first time I'm reintroducing that. Okay. Anyways, so what causes it? It's caused by, I still call it, to tell you the truth, I still call it like Giardia lamblia. I still call it that, but now it's named Giardia intestinalis. Anyways, it's just a diplomonad protozoa that's flagellated. It looks really interesting, guys. It looks something like this, and it has two nuclei, and so these two nuclei make it seem as if it has eyes. And as you can see, it has like this ventral disc, like the other side of that circle is a ventral disc, and that's what it's going to use to attach. Oh, here we go. That's the other side, ventral disc right here, the ventral adhesive disc. That's what it uses to attach to your intestinal lining. And it pretty much like covers your intestinal lining, kind of like what you see here. It covers it, and this is why we have malabsorption. So it prevents the absorption of nutrients in the intestine, because you have, like in the places where it normally would do so, through the villi of your small intestine, etc. They're all now covered with these nasty little nasty little creatures. And you can see how it forms a cyst here as it goes through the stomach, and then once it situates itself in the stomach, in the small intestine, that's where it's going to exist and start into its trophozoite form, which is like the motile. See how it's flagellated, motile feeding form, And so then it's going to attach via the ventral disc to the stomach lining and prevent that absorption. Okay. Yeah. So the cyst can survive for months, and it can survive a lot of things. I kind of already mentioned them, like things like heat, even chlorination. So it is difficult to, like, in order for you to drink uncontaminated water, it has to be filtered. Upon consumption of contaminated water, the ingested cyst releases trophocytes in the small intestine. They multiply and they interfere with the intestinal absorption of nutrients because of that ventral disc attaching to the small lining of the small intestine. The diagnosis is usually done by actually finding these cysts or these trophocytes in your stool. It usually is cysts though, because as soon as they are released back in the environment, they want to kind of protect themselves a little bit more, so they form cysts. So it's finding those cysts in your sample. You can also do the DNA test, right? Not DNA test, but have like a nucleic probe, like the X-tag GGP, which we've been talking about for a long time. And that's just going to be specifically probing and looking for DNA that pertains only to Giardia and not to you. Some infections resolve themselves spontaneously without treatment. It can be resolved between like 1 and 4 weeks. Other ones, they can get really chronic and just do severe damage to your intestine as well. And so the treatment is with tinidazole, even though, metronidazole is actually used more in the United States because tinidazole is actually not approved by the FDA. And then, of course, supportive care to replace loss of fluids. Prevention is just making sure that you filter your water and you drink just filtered water, especially in areas where it's endemic. Neither humans nor their pets should drink unfiltered stream or river water, and it's an excellent hygiene must be practiced. So that is Giardia for you guys. Yeah, it does look cute, but it's not. Then we move on to basically parvo or cryptosporodiasis. I can't ever say sporodiasis. Here you have severe watery diarrhea that occurs several times a day. I remember my dogs actually had parvo, and it was just nonstop. And this can last about 2 weeks. You can have other symptoms like headache, muscular pain, cramping, nausea, fatigue, severe fluid and weight loss accompany the diarrhea. And then in addition, you can further complicate the disease by adding other stuff like malabsorption, hepatitis, and pancreatitis. So that can also happen. So it is a zoonotic protozoan. So it's called by the Cryptosporidium parvum. Hence it's also called parvo. Its infection is most commonly results from drinking water that's contaminated with oocysts. Oocysts are just the kind of like the eggs of the Cryptosporidium parvo. And from it, like about, I think it's like 4 or few trophocytes come out of it. So that's just how it can be transferred. Or you can have direct fecal oral contamination or transmission, and that is, you can also ingest like the trophocytes. So the livestock are the most common source of oocysts as well. In healthy adults, the infection spontaneously clears up, often up to a month. This is more kind of a problem when it comes to people that have that are immunocompromised, right? So immunocompromised people are more at risk. Epidemiology, about 30% of people carry it asymptomatically in developing nations. And there we go. Immunocompromised persons are at risk for severe or chronic diseases. So in order to see it, you observe either the oocysts or the trophocytes in the feces. And again, you can also identify with the nucleic acid patterns, like those nucleic acid probes. To treat, you do have a means of basically shortening the duration of the parvo by giving nitaoxazanidide. I think I butchered that one. And then, of course, fluid and electrolyte replacement, which is always key for every single one of these kind of diseases, pretty much. Then prevention requires good hygiene, avoiding consumption of contaminated food or water, and even avoiding fecal exposure during sex. So any kind of like oral anal sex could also result in this. So people who are like homosexuals as well are at a lot more risk to getting cryptosporodiasis. So yeah, I think that's all I have to say. Oh, amoeba. Yeah. Okay, amoebiasis, this is basically when an amoeba causes a problem, right? And it's interesting because the amoeba it says here is no defined shape. Of course, there's no defined shape because the amoeba has those pseudopods, remember, to move. And those pseudopods are used not just for movement, so it has that cytoplasmic streaming that allows for these pseudopods to kind of like extend and move the actual protozoan, but they also like the pseudopodia can attach to the intestinal lining, and so that's So they use the pseudopodia to move and acquire food. So depending on the individual's health, and usually there's a lot like people that are pregnant, like younger adults, like immunocompromised, etc. They're a lot more at risk to developing the more chronic and terrifying forms of amoebiasis. But a lot of times, most people, if they're healthy, have luminal amoebiasis. And so I said biasis, biasis, I'm not sure how to pronounce it, luminal. So that's basically when they stay inside your lumen. This particular one is when the strain of the amoeba, which is pretty much always Entamoeba histolytica, doesn't have a lot of its virulence factors. So for virulence factors of Entamoeba histolytica, it just has many proteins, lots of proteins, lots of different types of toxins that it releases in us. I don't know if I go into it at all. No, I do not. But anyways, it's like these ones that do not, that actually give no symptoms of the actual infection only cause luminal amoebiasis because they don't have they don't have any of those virulence factors, any of those proteins or toxins that are released by the amoeba. And so this is fine to have. The thing though is the problem is that amoebas, or this like Entamoeba histolytica, the only host is actually humans. And so this is how we transmit it to one another. Like through fecal contamination of like water or food or other things like that. So the only host is humans. And so humans that actually have luminal amoebiasis can pass it on to other people without even knowing because they are asymptomatic. So that's the problem with that. But technically that doesn't do anything. Like you're fine, you're good to go. Then we have things like when it gets a little bit worse with amoebic dysentery and extraintestinal amoebiasis, which is when it gets even more chronic. So amoebic dysentery, this is characterized by severe diarrhea, colitis, appendicitis, ulceration of the intestinal mucosa. And so because of that ulceration of the intestinal, like the mucous membrane of the intestine, you can get blood leaking in. And so of course your stools and everything can be bloody. And so it's also like you have like an internal bleeding as well with amoebic dysentery. Then we can move on to extraintestinal, or it can move on to extraintestinal amoebiasis. That's when it leaves the intestine and it moves on to things like the liver, the lungs, spleen, kidneys, or brains, and we have like these necrotizing lesions within those organs, and that's when it can be fatal. Like it can legit be fatal. Amoebic dysentery is also not fun. Like it can be fatal as well, but usually this transforms into extraintestinal amoebiasis by that point. So all of these are caused by Entamoeba histolytica. It causes all forms, and it just depends on the various like strains and virulence factors that it has. One thing is, so like I said, the luminal kind, it doesn't have any virulence factors, and then to cause the amoebic or the amoebic dysentery or the extraintestinal one, it's going to have those virulence factors. Okay. And so infection typically begins with the consumption of food or water, and this food or water has cysts. So this is another example of a protozoa that can form a cyst, just similar to Giardia. It can form a cyst and therefore pass through our stomach acid and then situates itself within the intestine. It can come also from contaminated hands or during oral anal intercourse. Basically anything that has to do with human feces, because remember, it's humans that are the ones who are transmitting this amoeba, Entamoeba histolytica, and so it just continually gets passed on by us. And you think that because we're pretty much the only host, right? Like it would be hard for us to get, like it would kind of die off. But again, people that have luminal amoebiasis don't even know. And this is just how nasty humans are in the first place. Like just hand washing, very critical. The parasite reproduces in the large intestines and does little damage when in the lumen, right? But virulent strains cause diseases when they invade the peritoneal cavity and the bloodstream, and of course they get to dysentery or extraintestinal amoebiasis. Okay, so it is carried around asymptomatically with luminal amoebiasis. About 10% of the world's human population has this. 500 million people a year, okay, get it. 90% are luminal form, and then 10% can be dysentery or the invasive extraintestinal kind. It can be fatal. About 100,000 people die annually, so not fun. The diagnostic is seeing cysts or trophocytes, which is, remember, that motile feeding form, that motile feeding phase in the stool. The treatment involves oral rehydration therapy and antiamoebic drugs like paramycin. Yeah, paramycin. And yeah, and then basically you can also use for things when it gets to really bad types of amoebiasis, you can use metronidazole as well. Oops. Preventive measures. So there's a few preventive measures. It's basically, it involves like kind of just, again, practicing good hygiene and avoiding uncooked food, drinking bottled water, peeling your fruit as well. So I use, like, especially if you come from an area where there's just, it's very prevalent, you make sure that your vegetables are always clean. You clean your vegetables properly, you peel your fruit, you never eat like the peeled fruit. I remember when I was little and going to Italy and being able to eat like the actual like skin or the peel of the apple, and I was like, what's happening? I was freaking out. So when you go to a place like Ethiopia, you want to make sure you, or like, you know, a third world country, you want to make sure you peel everything. We even went so far as to remove the tips of the banana. And I still do it to this day, even though there's no real need of it here in the United States, but because like from the peel, it can go inside. I don't know how true that is. I haven't actually looked it up online, but it's just something that has been ingrained in me to just clean all vegetables and not eat banana tips. So let me know if anyone else does that, because I'd be interested. Yeah, make sure you have effective water processing, good personal hygiene, and safer sexual practices. Ooh, that's it. That's it for protozoa. Fantastic. Okay, I think I'm gonna upload this and make another video.